I'm Joe Condon. Welcome to our program. Today we are honored to have a gentleman who is head of the Mental Health Association of New York State, Mr. Glenn Lieben, with us, and he's going to be talking about mental health and the role of the Mental Health Association of New York State. Glenn, nice to have you with us.
Thank you very much, Joe. Glad to be here.
What is mental health?
What is mental health? Mental health is about an individual's well-being and the ability to live life successfully and, happily in a positive path. I think that's really, you can get into definitions about mental wellness and mental illness, but mental health overall is just being able to live life successfully and productively. That's good mental, and there are all kinds of practices around good mental health, but mental health itself is living life productively and successfully.
What is mental illness? Mental
illness is a biological brain illness that affects your the chemicals of your brain. There are chemical imbalances that might impact your cognition, impact various aspects of yourself, so that it does impact you. So.
You were saying statistically, before going on the air today, that 20% of the population, or 1 out of 5 people, are mentally ill. How can you tell that someone is mentally ill, or how can their relatives tell, or how can they tell?
Well, I mean, it's hard to say. I know that there have been a lot of surveys that have been done nationally. There have been all kinds of studies that are done that really indicates that based on, historical information, based on data that has been collected, based on, sort of all the cumulative data, it indicates that 1 in 5 people have some sort of mental illness. Again, we're talking about anxiety disorder, we're talking about depression, we're talking about bipolar disorder, we're talking about schizophrenia. Those are largely what we're talking about when we're talking about this cadre of people.
What's your definition of schizophrenia?
Well, schizophrenia is a disorder in which somebody has both issues with delusions, and they have other issues as well. And I think what we do with schizophrenia is that there are now things have changed dramatically over the years in terms of the ability to work with an individual with schizophrenia when they have delusions. And so what is done is there are much better medications than there used to be in the past. There's much better psychotherapy than there used to be in the past as well. So there clearly are methodologies for someone with schizophrenia being able to move forward in their lives.
What is bipolar? What kind of
bipolar
is that?
Well, it's sometimes referred to as manic depression, but those are where you see the mood swings of an individual, where somebody could be very high and very active and all over the place, and then they have an incredibly mood swing where they become very depressed. And what characterizes really bipolar is those incredible mood swings.
Is that the kind of person, and I've met people over the years, that there is no middle ground, either the person is on a super high or a super low?
Right. I mean, and it's hard, a lot of times it is, but it's so hard to generalize because, mental illness itself is so individualized. I mean, you have the definition, your classic definition of schizophrenia, you have your classic definition of bipolar disorder. And again, I'm not a psychiatrist, I'm not a clinician, so, I don't, you can probably argue about those specific definitions, but it is clear that everybody is different and everybody reacts differently to different stimulus.
Do you feel that if you are mentally ill, that you are responsible for your actions, or does it depend on the degree of mental illness?
It totally, just a good question, it totally depends on, again, it's so individualized. Everybody's different. It's so hard to say, and it depends again on the degree of the illness. I mean, there are different degrees of the illness. There are different diagnoses. Obviously, there's schizophrenia, there's schizoaffective disorder that are probably among the most difficult to work with.
Now, watching Law and Order over the years, I've sensed from that show that it's almost a fate worse than going to prison to be sent to a mental institution. Mm-hmm. Do you agree with that? That's the innuendo on that show.
Right. I think that has I mean, there's obviously the the literary license that they take, the TV license that they take with the show. I think that the state forensics facilities, again, there are a few of them in the state. We have a lot of psychiatric facilities, but we have just a few specifically for forensics patients. And I think that they are state of the art. They've done a much better job over the years. There's a stereotype of what they once were, but I think there's been a lot of resources and a lot, as our knowledge base increases, I think that people are more knowledgeable about how to deal with people with severe psychiatric disabilities who've done something, have been in the criminal justice system. So I think they are better than they were, but by no means are they a safe haven or anything like that.
And it's probably an archaic word, but people over the years who have mental illness and need hospitalization, they were put in something called a mental health asylum. And the impression that I have, and I think many others have, is that basically when someone goes there, they're really not going to get better, and it's just like they're almost drugged to be kept under control.
Right.
Is that a false assumption?
That's definitely a false assumption now. Again, the state, we have more psychiatric facilities in New York State than any other state in the nation. But I think, again, they are much more geared than they used to be. And they also run outpatient programs, so they're not just running inpatient programs. Yes, there are 4,000 people in New York State who are in institutions, but they also, these institutions, like right here in we have the Capital District's, the CDPC, Capital District Psychiatric Center, and they run a lot of outpatient programs too, so not just doing inpatient programs. But the reality is that the length of stay of people who are inpatient is decreasing. I think that we are more, again, the medications are better, and it's not only about the medications, it's about the will of the individual. I think there are a lot more empowerment strategies for individuals, and there's a lot more teaching about recovery model and people moving forward in their lives. And I think that they've been able to, the psych centers have been sort of using more state-of-the-art, things than they've done in the past, and people are able to move forward in their lives. Not everybody. I mean, there are people who are in the back wards of psychiatric centers who have been there for many years, and despite the best of medications, the best of therapy, they're still not getting out there. So there are a cadre of people, but we believe that the Mental Health Association, we've been around for a long time. A lot of our members are themselves have psychiatric disabilities. We believe that most people, if given the proper supports and services, can live very productively in the community.
We were talking before going on the air today, going back into ancient times with the Christians in the Colosseums at Rome, taking their own lives because of their faith. We had the pilots in the Japanese Air Force during World War II, the kamikaze pilots, dying because of the emperor.
Sure.
We had, this year is the 10th anniversary of 9/11, we had people crashing into the World Trade Center or other places dying for God. What sort of an impact does religion play in mental illness?
Well, again, it's hard to say, and what we always say is that it's so individualized. You can't say, well, because of this religion or that belief or this belief was the reason that somebody took the action that they took, which would be, to the average person, is like, why would somebody do something like that? Is somebody more vulnerable because of their own whether their brain chemistry or just the way they were brought up? What's the environment versus their nature versus nurture? So it's hard to say the impact of religion. I think religion, the positive piece about religion is that religion could be part of a healing piece for an individual.
Right.
When you asked me the first question about what is mental health, well, mental health, I mean, what is good mental health? Good mental health is somebody who has the ability to sort of use their religion or whatever spiritual beliefs they have to be more positive about, their own health. So I think it could be a positive. Whether you're talking about this is a, this itself is somebody does something like this is mentally ill. Well, that is a subject that I can't claim to be an expert in those areas. That's
would you
more clinician.
Feel that some people are, and you would probably know the term better than I would. Some people are born leaders, and some people are born followers.
Right.
And do you think that born followers can be misled by someone who is a leader? And probably, I guess you would call it brainwashing. And does that make someone who's been brainwashed mentally ill? Good questions. I really, again, those are questions that you would want to be more somebody who's a much more expert, a psychiatrist or right.
psychologist than, or another clinician would be able to answer much more than I can, because again, there's so much that goes on. It's that nature versus nurture. What's the reason that somebody takes the action they take? Is it because of the environment they grew up in? Is it because they have a predisposition to do something like that? It's hard to say. It's hard to generalize why somebody would do what they do.
Well, you hear about environment, and that's something which crossed my mind when you talked about New York State having the largest number of mental health facilities. Is there something in our air? Is there something, because we have so many power lines in areas? You hear about these different things. You have the nuclear reactor down in New York City.
Sure.
Is there some, environmental reason?
Not that I know. I mean, again, I think that we're probably consistent with the rest of the nation in terms of the population of people who have a psychiatric disability.
Right.
I think it's pretty consistent across the board. I don't know that we are any, an outlier in terms of, our numbers more than any other state. And again, I think that the psychiatric facilities themselves are sort of a vestige of a past of kind of figuring out the best way to work with people with mental illness. And that's sort of an infrastructure issue more than a mental health issue.
Everybody has good days and bad days.
Sure.
But what is your definition of depression, and how can it be treated?
Well, I think depression is, yes, we all have good days and bad days. I think it's a progression. If you have a series of bad days that go longer, I think it's about 2 weeks or 4 weeks, and anybody can go online and sort of see those series of just Google depression and symptoms, and you'll see, it's generally over a long time. Yes, and obviously there's situational depression if there's a tragedy in your family, and it's natural that somebody's going to be depressed about it. When both my parents passed away, of course I was depressed about it. That's a natural situation, situational depression. But if it's over the long haul, it happens, and you see the symptoms of somebody, the general malaise, somebody used to be upbeat and positive is all of a sudden, just seems to be in a funk over a long period. If you see someone's, they're not getting any sleep, they're losing their appetite, or they're eating more, just a complete sea change in what they've done in the past, all of a sudden then that's a sort of those are the kind of signs you're looking for. And in terms of the good news is that people with depression do really recover and move forward in their lives. It's not as simple as popping a pill. There are better medications. There are antidepressants that are better than in the past. But
right.
You also, for the most part, we know in terms of evidence-based best practices that it's the medication, but it's also the psychotherapy that goes with it. There are various techniques that can be used, whether it's things like cognitive behavioral therapy, dialectical behavioral therapy, or other psychological tools that can be used to help an individual with their depression.